The leg consists of a lateral compartment around the fibula, supplied by the superficial fibula or peroneal nerve, because it's next to the fibula, an anterior extensor compartment between the two bones, supplied by the deep fibular nerve, and this is bounded by crural fascia in front, and the two bones posteriorly. The posterior flexor compartment is divided into superficial and deep regions, and this makes up the calf muscles, supplied by the tibial nerve. Blood supply is from branches of the popliteal artery, and there are two neurovascular bundles, one with plenty of space in the posterior compartment, and the other, for the anterior, is squashed against the interosseous membrane. Most of the blood and the nerve supply in the leg and foot comes from the sciatic nerve, but before this gets to the lower leg, it's divided into the tibial and common fibular branches. The sciatic nerve innervates the skin of the lower leg apart from the medial aspect of the foot, which receives innervation from the saphenous nerve, a branch of the femoral nerve. All the blood supply to the lower leg comes from the popliteal artery, as I said, and this divides into anterior tibial and posterior tibial branches, with the posterior giving rise to the fibular artery, which supplies the lateral compartment. All the venous blood from the dorsum of the foot travels either laterally into the small saphenous vein at the back of the leg, or medially into the great saphenous vein. The great saphenous vein goes to penetrate the deep fascia at the saphenous opening to enter the femoral vein at the top of the thigh. The short saphenous does the same thing at the popliteal fossa, where it enters the popliteal vein. The great saphenous vein is found at a finger's breadth in front of the medial malleolus of the ankle. That's the bony prominence at the ankle, and this is often used if a patient's in shock and no other vein can be found. So these veins are the superficial veins. There are deep veins of the leg, but they follow the arterial pattern. All of these veins contain valves, and the flow is from superficial to deep under normal circumstances. If this becomes reversed, then you could get varicose veins. The tibia, which is the larger of the two bones of the lower leg, and the main weight-bearing bone, has a lateral and medial condyle, which serve as the bony attachment of a lot of the upper leg or thigh muscles. Tibial tuberosity. Intercondylar eminence, which is the bit that sticks up around where the cruciate ligaments are that join the femur and the tibia. Across the back is the soleal line, and that marks the inferior edge of the attachment of the popliteus muscle, sometimes called the popliteal line. And the medial malleolus, which forms the bony part of the ankle. The fibula, which is the smaller of the two bones, so not weight-bearing, has the lateral malleolus, which is the ankle on the other side. And it also has a medial crest, which is a line running down its medial surface, which marks the attachment for the interosseous membrane of the leg. The superior tibiofibular joint is a synovial joint with a joint capsule, but little movement takes place in it. It's in an entirely separate capsule from the knee joint. The inferior tibiofibular joint is a syndesmosis, or a fibrous joint. This takes part in the ankle joint and must remain completely stable, so it's got very strong ligaments. These are the anterior and posterior tibiofibular ligaments, and an interosseous ligament between the two bones, which joins them together. Then there are ligaments connecting the fibula with the foot, and these are the anterior and posterior talofibular ligaments, and the calcanofibular ligament.